Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Did you know that up to 60% of women report cognitive changes during their menopausal transition? Today, we're going to explore the science behind these changes and discuss evidence-based strategies to support our patients through these transitions. Hello, I'm Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. I'm so glad that you could join us as we take a deeper look at how menopause affects the brain, specifically around cognitive function and mood. You know, with approximately 1.3 million women entering menopause each year, understanding these neurological impacts is really crucial for being able to provide comprehensive care in women's health. Joining us for this discussion is Carrie Levine, a nurse midwife and functional medicine practitioner. Carrie, thank you so much for being willing to share your expertise in this area.
Thanks for having me.
Yes. Now, I noticed that you really got started in women's health. Before you got started in women's health, your undergrad degree was in public relations and women's studies. So how did you pivot over to be a nurse midwife and a functional medicine practitioner?
There could be a very long answer to that question, but the short version is I was interested in gender communication largely, and that funneled me weirdly somehow into public relations. And I was pretty clear early on that I was never going to go to New York City and be a PR person, that I had a long-standing interest in and experience in working with women, and I just wasn't really sure how I wanted to do that. And I talked with a mentor, and she said, what about a nurse practitioner? In the state of Maine, we're licensed to practice independently. And I was like, that's interesting. And then when I was applying to school, I wanted to take care of women through the entire lifespan, including the childbearing year. I didn't want to be a women's health nurse practitioner and skip the childbearing year.
Yeah.
So that was how I ended up in midwifery. And the functional medicine piece, nurse midwifery was not a great match for my personality in terms of sleep deprivation and
Yes.
the rigor of all of that. And during my time practicing, I also had my own children. And so it was tough. It was really tough. And I found a job at Women to Women, which was a pioneering women's health clinic. And when I got there, there was language for everything that I had sort of understood about health and found interesting, and it was within the functional medicine model. And so then Women to Women really supported my early training. And then from that sort of seed went on to get certified and then ultimately start my own practice.
I love your story. And functional medicine, I have so much interest in functional medicine and that model outside of, our regular patient care model, just the things that it offers and the care that it offers holistically. So I love that you're combining the two together. And for this podcast, I know that our focus is really going to be on menopause, but we do hear term, the perimenopause, which I think I'm close to, the menopause and the postmenopause. And can you just start with breaking those down? Is there a marker that, oh, I know I'm in perimenopause and now I'm in menopause? Like, how do we know? What can you break those down?
Of course, it's such a good question because the terms are used interchangeably, not accurately. And so it really, some of the language around this stuff can be challenging and misleading. So perimenopause, I like to say, is all of the nonsense that happens after the age of 35 up until a year until we've had our last period. And so I would say most women start to notice some change to their menstrual cycle, whether it's the cycle itself in terms of how many days it lasts or how heavy or light it is, or skipping periods or closer together or further apart or more mood changes or whatever the issues may be. And
Hmm.
that can go on for, I hate to say it, but it is true, decades.
Oh,
Yeah.
well, I have a personal perimenopausal question. But I'm sure that so many other people have this question too as women, but do your periods get more painful as you get older?
It varies. It really varies. It's really like labor. Every
Yeah.
labor is different, and
Hmm.
every woman's perimenopause largely is different. There are some universal experiences, I think,
Yeah.
but I wouldn't say that all women across the board have a period that gets more painful in
Hmm.
perimenopause. I would say for some women, it goes the other way.
Oh, no.
Yeah.
Okay. Okay, back to the original question.
Yes, of course. So menopause is the year anniversary of having your last period, and it is a
Wow.
day. And you only know that day looking backward. So let's say someone had a period January 1st, 2024. When
Hmm.
they got to January 2nd, 2025, they were in menopause.
Oh,
On
wow.
January 3rd, they're considered postmenopause.
Really?
Yeah. So that's the technicalities of the
Hmm.
definitions and around the language. And I mean, I think and certainly public media, people will say menopause, I'm in menopause, or I'm menopausal, or even the name of this podcast, right? Is
Hmm.
like
Hmm. Hmm.
menopause is actually a 1 year anniversary. So we could rename the podcast Postmenopause and Brain
Yeah.
Health.
And
Although,
we would still have the same objective.
yeah, and it doesn't mean that the brain changes don't happen during perimenopause, because for sure, absolutely, positively, that is one of the common experiences that women have, which are some of the brain changes that start to happen. The
Uh-huh.
word retrieval, the memory issues, the difficulty multitasking,
Hmm.
the mood lability that happens over the course of the cycle, or the skipping of the cycle. Like all of that can start
Yeah.
perimenopausally.
Now, are there lab markers that can be used to determine, how far out you are, how close you are, or if you're there? Do they?
Absolutely not. And
Okay.
and that is part of what makes me crazy about some of what I see happen in
Hmm.
conventional care, right? As someone will
Hmm.
get their primary, or whoever may order a FSH and estradiol. And generally, if
Hmm.
the FSH is higher than 80 and the estradiol is less than 20, that is thought to be the diagnostic criteria for menopause. However, the hallmark of this time of life is
Yeah.
chaos. And
Yeah.
so, and no cycle and absence of cycle. And so you really have no idea when you're testing someone's labs, where are you catching them? Are you catching them in a place where they consistently have low estradiol and high FSH? Or was it just that
Hmm.
moment, and tomorrow, oh, the body's going to ovulate, and oh, those hormone levels are going to be different, and you just never know. So I like to say, if I could create a crystal ball that would
Hmm.
tell a woman when the baby's going to come and when
Hmm.
she would have her last period, I
Yes.
would not have to work. I would still work because I really love
Yeah.
my job. But but there are
Yes.
things in women's health that remain a mystery. And I'm grateful for that mystery, that we don't get to know it all and we don't understand it all. When and why does a baby come? We still don't know. Isn't that beautiful? And
Right.
when and why
Hmm.
might a woman have her last period? Don't really know some things that can be indicators,
Uh-huh.
right? Family history, mom's age at menopause or last menstrual period, age of menarche, these things can be indicators, but they're not certainties.
Right. So going back to those cognitive changes,
Yeah,
really we're going to be seeing those cognitive changes in perimenopause, right?
for sure. I mean, I would
Hmm.
say many women probably see them even through the course of a menstrual cycle,
Hmm.
right? Any sort of hormonal
Yes.
punctuation. Or, oh, how about menarche?
Hmm.
How about teenagers and
Yeah.
hormones and brain changes and mood changes, right?
Hmm.
Um, I was reading the menopause brain as this podcast was just really a good prompting. It
Hmm.
had been on my list anyway. And Dr. Lisa Moscani, who's a neurologist, talks about the three Ps, which I think is sort of a fascinating. It's a little bit like, how come I never thought of that? She talks about these three giant hormone events in women's lives when we go through a lot. And part of
Yeah.
what we go through is cognitive. And so she talks about period, pregnancy, and peri and postmenopause, right? There are
Hmm.
just giant things happening to us, and our brain is not left out of that equation. Our brain is
Right.
part of that equation. And part of what I love about what she talks about, and I really can't recommend her book strongly enough because she just has such a positive framing of these cognitive
Hmm.
changes. I think for so many women, it's terrifying. And
Yeah.
women will come to the clinic and say, I feel like I'm losing my mind.
Yes.
And she talks about these three Ps as being sort of times where there's system overhauls or system upgrades to our cognitive function.
Hmm.
And she talks about what we need cognitively as new moms or as moms is really different from what we need when we're a teenager and we get our period, which is
Hmm.
also really different from what we need menopausally or postmenopausally. And we lose cognitive connections, but that isn't necessarily a bad thing. I think about this a lot because I hear it a lot in the clinic. Women come in and they're like, I cannot multitask like I used to. I
Hmm.
cannot juggle things the way that I used to. Like I just brain wise cannot manage it. And I think about myself, I'm 54, and I think about my own sort of hormonal journey and professional journey. And what I am finding personally is that I have to have days where my brain is not on like it is at work.
Hmm.
I need
Yeah.
days where I'm not having to think critically and problem solve and take in information. It's just like, my brain needs a break. And
Yes. Rest.
totally. And just this idea of like, yeah, okay, so you do kind of lose part of your mind. You lose the part of the multitasking that is necessary if you choose to be a mom and have children, or at least you're
Hmm.
logically wired to do that. And you don't actually have to do that later in life when kids aren't home. And so the pathways change. And isn't that a beautiful thing? We
Hmm.
let go, our brains let go of some of those pathways that help us survive and do our jobs and develop new ones as we need them. How beautiful and positive is that?
Yes.
As opposed to, I feel like I'm losing my mind and I'm afraid I'm getting Alzheimer's.
Yes. so so speaking on that piece of it, what are those common cognitive changes that are associated with this time in our life?
I mean, sort of the ones that I've alluded to, right? So there is
Yeah.
definitely challenge with word retrieval. There is difficulty with memory, short term and long term. Like, where did I put
Mhm.
my keys? What did I come into this room for? I cannot remember. What is that
Mhm.
person's name? What was I supposed to get at the store? Did I write it
Mhm.
down? Where's my list? I can't find it. All of that, along with oh, it just left me. What
There it is.
there it is. Um, Memory, cognitive function, just like mood, right? Like a
Yeah.
decline in
Mhm.
mood.
Mhm.
Some would say depression. that I think is a super tricky word. And like menopause is used maybe too frequently and possibly inappropriately. Some women
Yes.
experience an incredible increase in anxiety,
Yes.
particularly with declining levels of estrogen. And then I think
And
the
that was my next question, though, was about those hormonal changes and how they actually play a role in affecting the function
of
of the brain function. Like, how are those hormonal changes that we're seeing?
yeah,
What are those hormonal changes that we're seeing? And then how is that affecting our brain function? Why is it affecting our brain function?
yeah. So I think one of the little known truths about estrogen is that it is anti inflammatory. So when we have estrogen on board, we
Mm-hmm.
have a layer of protection against inflammation. And
Mm.
when estrogen levels start to decline as we age, which is completely normal,
Yeah.
physiologic, developmentally appropriate, nothing pathologic with that process. But women experience more inflammation, and that can be in the joints, that can be in the skin, that can be in digestion, that can be in cognition, that
Yes.
can be in overall immune system function, right? And so,
Mm-hmm.
like, the incidences, I'm not really a statistics kind of person, maybe you know this information, but, um the number of midlife women diagnosed with autoimmune disease is it's like there's a statistical significance to that, right? And I think of that as lower estrogen, more inflammation. So, the estrogen is going to affect, our immune system. It
Mm-hmm.
affects cell growth. It affects plasticity, which is the ability of neurons to communicate with each other and regenerate each other. I don't know that people know that neurons will reach dead neurons and like resuscitate them. And this is one of the things that happens with exercise. And one of the
Yeah.
reasons why exercise is so crucial to um, brain health and protecting cognition, and particularly during the postmenopausal years.
Mm-hmm.
Um, Estrogen has a role with serotonin, which is that neurotransmitter, that antidepressant neurotransmitter, and it affects cardiovascular health, right? So vasodilation
Yeah.
is big, heart health, the cold fingers, the cold toes, all of that, and energy. Estrogen has a role in glucose regulation. So
It's
it's
a lot going
everywhere.
on.
It's
Yes.
everywhere. Yeah.
It is. And why does it impact our memory and our concentration so I mean, it feels like for me, I know it feels so severely, like you're saying, where we come in and we're like, I think I have early onset dementia. I'm not sure what is happening, but why is it so intense?
I think that there's a couple of factors at play, and I would be remiss if I didn't at least nod to the HPAG axis, or the hypothalamus pituitary adrenal gonadal axis, right? And the
Hmm.
interplay between the brain and the adrenals and our stress hormones and our ovaries. And what happens for midlife with cortisol levels is its own special thing, right? A lot of us, there's a
Hmm.
little bit of a perfect storm. There's an accumulation of not having taken great care of ourselves that we can't really sustain anymore. It's sort of a beautiful, innate mechanism where the body is like, yeah, no, actually, you will take care of yourself now so that you survive.
Hmm.
You will take less care of other people. You will put yourself on the map. You will give yourself some of the time, energy, and money that you have given to family or careers or whatever.
Hmm.
And so the body is pretty much like, hi, I'm over here and I'm going to get some, or I'm going to take you down.
Yeah.
So there's I think a complicated relationship between stress, cortisol, and estrogen in terms of cognitive function. There is also a change in the gray matter of the brain, according to Lisa Mosconi. And that has to do with function. But
Hmm.
one of the things that I think is so interesting about her research, and yet another reason why I'm plugging her book, this isn't like a pro Lisa Mosconi plug her book, but I learned from reading, so I like to share what I learn. And
Yes.
she takes pictures of uh, you know, a young woman who hasn't started menstruating yet, a teenage woman who's just gotten her period, a pregnant woman, and a postmenopausal woman, and looks at what happens with the gray matter. But one of the things that she does is she looks at women's brain postmenopausally, and the loss of gray matter that happens during this transition, it comes back.
Mm.
And I feel like that message is so important and is so not being talked about, that
Hmm.
this is a period of transition and we adapt and our brains adapt.
Hmm.
Our brains are really good at adapting. They just need some time. And so, if while we're in the turbulence and we're in the muck and we're in the fear and we're in the mess of it, if we can just hang on to the knowing that we adapt and our brains adapt. Do we get back to what we were? I'm not really a big fan of this idea of going back, right? Like women are like, I want my pre pregnancy body. I'm like, it's never going to happen. You had a
Hmm.
baby. Your belly is never going to be the same. Your breasts are never going to be the same. If you had a vaginal birth, your vagina, it's never going to be the same. So can we free ourselves from this idea of going back?
Yes.
Can we move forward into a new place of strength that is different and shaped by some of these
Hmm.
pivotal, life changing experiences? I think we can. I think we can.
Absolutely. There's so much to think about. There's so much change. And, you know, going back to why is there such a stigma, do you think, around menopause? Why are we so scared of menopause? All these changes that are coming.
Mm. Well, now that's complicated to answer, isn't it? Right. I think one of the biggest challenges is the expectations that women have of ourselves,
Hmm.
right?
I
We
can agree to
expect
that.
ourselves to operate at the same way, at the same level,
Hmm.
no matter if we are pregnant or we're postpartum or we have small children at home or we're working full time and momming full time, or we are perimenopausal and not sleeping because we're hot flashing and night sweating and worried and
Hmm.
anxious, and we expect the same thing for ourselves. I do think that there is an entire movement happening around looking at the cycle, a menstrual cycle within the course of a month, and the cycles of that happen over a longer stretch of time in women's lives, and beginning to acknowledge that those hormone fluctuations really do affect us. They affect what we eat, they affect what we want to eat, how
Hmm.
we metabolize what we eat, what we drink, how we move, our energy, our weight, our um, digestion, our cognitive
Yes.
function. And and I feel like the place to start first is with ourselves and allowing
Hmm.
ourselves some variability. Like, can we be okay with the fact that we can no longer multitask? Can I accept when I'm not in the clinic that I need to be not engaged in intellectual things? I need to be more
Hmm.
engaged with my emotions and my body and my creativity. Can
Hmm.
I create space in my life for that? Can I create a life where there's room for that? Do I work too much that that's not even possible? And
Hmm.
so there's that aspect. And then I think there's, what the people around us get accustomed to us doing and managing, right? Like in
Hmm.
so many ways. So often we are our own biggest problem in terms of over functioning and other people acclimating to that. And when we're like, yeah, no, I don't actually want to cook Christmas dinner anymore. Or, yeah, no, how about you do your own laundry for a change? People are like, what? You know?
Yes.
And like I say to women in the clinic, nobody is going to roll out a red carpet for you to make time to exercise. You have to
Hmm.
claim it. And you have to figure out where in your week you can plant it. And if you can't figure it out, you may need to change your life.
Yes.
And that's, I have the luxury of being able to have those kinds of hard conversations and those
Hmm.
kinds of process conversations, those nitty-gritty lifestyle conversations with women because I'm not bound by a 7-minute or a 15-minute or a 20-minute visit. You know,
Right. That's what I
I
like
s-
about functional medicine.
yeah.
um,
Mm.
but as we're talking about these hormonal changes and these, as you're talking about those neurological changes that are happening and those symptoms that are happening, does that increase the risk for neurodegenerative diseases?
There is an increased risk for women and neurodegenerative diseases, but I think that that's, first of all, neurodegenerative disease is very poorly understood, in my opinion. And
Yes.
functional medicine has, I think, a lot to offer in terms of, sort of the genetic predisposition and the doomed and destined kind of trajectory. There is
Hmm.
a whole line of thinking around neurodegeneration that has to do with mitochondrial function, and it has to do with inflammation and brain inflammation. And that's where I go
Hmm.
back. And yes, is estrogen a piece of that? Heck yeah. Absolutely. And that's part of the new and revised findings around hormone therapy. I think we'll probably talk more about that later.
Yes.
There is thought to be some protection against Alzheimer's. And but it's worth asking oneself or one's patients, are you doing what you can?
Hmm.
There's also a lot of brain protection that comes from exercise. Are you doing it? There's also a lot of brain protection that comes from eating the rainbow, right? Eating foods that are a variety of different colors. Are you
Hmm.
doing that part, right? Like, are you doing the parts that you can? Not in a way of being perfect and sort of being obsessive and compulsive about it, like in a way that acknowledges that how we live also plays a part in whether or
Yes.
not we develop neurodegenerative disease.
But even though we are losing this piece of it, we're losing these protective hormones and things, we still have other areas and avenues where we can continue to do what we can to be healthy,
Yeah,
nutritionally,
yeah,
exercise and
yeah.
weight. And
Yeah,
so yes.
I think about there's a exercise physiologist named Stacy Sims. She focuses on women, and she's written 2 books, one
Hmm.
called Roar and one called Next Level. I had the good fortune of hearing her speak last June, and she had some amazing slides on how estrogen affects myosin and actin, I think, which are the 2 muscle fibers that create a contraction, and she
Yeah.
is able to show visually how estrogen promotes that. And strength training and interval training do the same thing in the place of estrogen. So while we're like losing hormones,
Hmm.
there are ways to replace them that go beyond just hormone replacement therapy, right? And that's where
Right.
like the strength training and the interval training,
Hmm.
kind of a non-negotiable for midlife women, in my
Yeah.
opinion. Like, we want to do that. We want to
Hmm.
do that for brain. We want to do that for bone. We want to do that for heart. We want to do that for body composition. And
Hmm.
you can't actually put all of that in a pill because the estrogen, the hormone replacement therapy, doesn't actually affect body composition the way women hope it will affect body composition.
Right. Well, we are out of time for this first episode, but Carrie, I just want to say how much I appreciate your view on menopause and perimenopause, and just really flipping that switch to say, you know, it might be chaos right now, but it's going to be okay on the other side of it. And just really taking time to remove that stigma that so many of us, you know, have. I don't really know where that stigma came from. I know for myself, but I just really appreciate you flipping that mindset today.
Oh, absolutely. I think there's a lot to look forward to.
Yes. Listening to you talk about it, I'm like, you know what? It's going to be okay. I mean, it is. It's going to be okay.
Yeah.
So thank you to our listeners and to you, Carrie, for joining us for this episode as we have explored that neurological landscape of menopause. In episode 2, we're going to build on this information, that neurological landscape, and Carrie is going to be back with us to discuss how we can support brain health during menopause.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.